Talk to you about congestive heart failure, and I know that sounds awful because nobody here obviously has it. But is there anybody here that has family members with heart disease? I know I do. Okay. I am going to argue that telemedicine can reduce the instances of readmission to the hospital for congestive heart failure patients. Now, heart disease has affected me profoundly. I lost both my grandfathers to it. My dad had his first heart attack at 40. My uncle had his first heart attack at 40. My aunt had her first heart attack at 39. I know it's going to happen. We're just waiting for it to happen. So, anyway, with that being said, I'm going to define telemedicine. Secondly, I'm going to discuss the research involved. And then lastly, I'm going to talk about why it's not more widely used. Okay. Nancy Brown, in her book, defines telemedicine as the use of technology to care for a patient at a distance. It can be as simple as two doctors picking up the telephone and talking to each other, consulting about a patient. Or it could be as elaborate as sending a satellite transmission of radiological image from New Delhi to New York City. What I'm going to be talking about is just the home monitoring units that are available for congestive heart patients once they get out of the hospital to be able to send the transmissions of their heart rates and their special stethoscopes and everything like that that they can use to send their information back to the physician. Now that we know what telemedicine is, let's talk a little bit about the research. The Veterans Health Administration did a study back in 2003, and when they put their telehealth plan in place, it reduced their hospital admissions, or readmissions actually, by 19%. Now Valley Home Care in New Jersey did it for the elderly population in their area. Veterans Administration did everybody. The Valley Health Care did theirs for the older people, and they had a 73% reduction in hospitalizations. 73%. That's incredible. Just imagine the improvement of their quality of life. You know, think about your grandparents. You know, imagine how much Medicare could save every year. I mean, this disease costs about $104 billion a year. That's billion with a B. So, okay, so we've proven the effectiveness that telemedicine has. So why don't more people use it? Well, the biggest reason is in rural areas, the telecommunications is not there. You can't use telephone lines. They just don't have the bandwidth. So, you know, there's been lots of strides in getting high-speed internet to outlying areas. So that's one of the big reasons. Also, you know, people are worried, you know, well, what about my confidential medical information? Well, it's all very confidential. HIPAA has rules to make sure that everything stays as confidential as possible. Now, we've seen that telemedicine has a huge impact on readmission to the hospitals. 73% fewer readmissions. That's incredible. So, therefore, I submit that telemedicine can reduce the instances of readmission. I just wish the technology had been around several years ago to prolong the lives of my grandparents.